YouTube comments from a video titled, "Medical System is About to Collapse. How to Save Yourself." Part 8.
As Cherie Muller 4722 wrote,
Medicare is ridiculous. Do I have food insecurity? Is someone talking bad to me and calling me names? Do I have reliable transportation? My medical doctor is my medical doctor, not my social worker. I am 70 years old and very independent. Keep your nose out of my business.
Terry Moore 861 wrote,
One fascinating issue is the question of the cause of dis-ease and why we followed the wrong path to the achievement of human health. One issue now receiving a great deal of attention is the belief that viruses may not even exist. Many doctors now believe in the possibility that illness is more to do with terrain theory and not viral theory. Ask any scientific medical authority to produce a peer-reviewed paper that confirms the isolation of any virus. The process used by the scientific community to attempt proof is fatally flawed. The history of medicine is fascinating. For most of human history, with good quality chemical-free food and low population numbers, there were plenty of sources of raw natural foods. As world populations increased, intensive farming was needed. Originally, snake oil, chemically based medicines, and dangerous surgical procedures developed. Gradually, tried, tested, and safe medicines evolved and surgical procedures improved. However, many of the early medicines were made from natural plant materials. Sadly, to produce enough for an increasing population, many safe medicines are now made synthetically from chemicals. Ancient understanding of human dietary needs was developed early in human history, and many, like the need for essential salts, were hidden and forgotten. The industrial pharmaceutical drug industry attempted to hide many of the tried, tested, and safe medicines and procedures, but as more suffer from allopathic medicines and procedures, some of the alternative, safe, tried, and tested medicines and procedures are being rediscovered. Hopefully, as more learn of the best procedures and medicines, including some of the allopathic drugs and methods, a more logical approach to health will develop in the future. The most important principle needed for good health is prevention, safe liquids and foods, and avoidance of dangerous man-made chemicals and gases. If we all use our brains and question everything, we can all lead healthy, stress-free, fulfilling, enjoyable, and long lives. If we take care of our planet, it will take care of us.
At Health 9818 wrote,
Let us be honest, it is a combination of the big hospital, big pharma, and doctors going into the profession to become wealthy. Everyone wants their kids to be doctors, lawyers, or professional sports players because they figure they will make bank.
At Naomi O'Connor 4107 wrote,
Fragmented. Like a foot DR can't do hip and hip can't do feet, even though both are in similar specialty. Oh, the my chart lies. Real surprising to read after visit notes and wonder who's being discussed. Certainty not me.
At Terry Moore 861 wrote,
Recent modern analysis of the causes of cancer now identify the growth of cancer to be the body's action and attempt to cure itself from exposure to carcinogenic and poisonous substances. The immune system is actually desperately attempting to remove the cause of the disease. Sadly, the evolution and ability of the immune system to deal with so many man-made chemicals prevents a reaction quick enough and becomes overloaded and confused. And if the cause of the cancer has not been identified quick enough, it just runs away and causes the crash of the body's ability to react successfully. We are what we eat. If we ingest too many man-made chemicals, we turn our body into a chemistry set. Prevention and dietary care can avoid the modern dis-ease, cancer. If preventative measures were employed to prevent the onset of cancer, cancer would disappear and all those seeking a cure would be unemployed. Cancer is almost totally missing from tribes living in remote areas where no modern agricultural chemicals are used or where there are no mining operations. As with all diseases, Ill people employ millions of citizens worldwide, making huge profits for the owners of pharmaceutical drug companies and medical equipment manufacturers. Healthy people are bad news for the modern health and research industries and cancer related organizations. Just imagine if all the people employed in the health industry could be employed in repairing our planet.
Katiana wrote,
I do not seeing it getting better. I also feel a lot of doctors nowadays aren't qualified educated and have no clue what's wrong with their patients. It's scary. I am so frustrated with these high cost, outrageous costs. I'm seriously considering moving to another country.
Terrymore 861 wrote,
So there are many causes of DISEs, and many of those are the result of man-made chemicals in our food, liquids, and environment. Food is increasingly deficient in vitamins, minerals, and trace elements. Essential salts are now also increasingly missing or unavailable in sufficient quantities. The study of essential salts was the subject of ancient Sanskrit teachings and science. So the origins of the study of essential salts understood under Greek mythology remained dormant until Dr. George Washington Carey published the first book in the 1800s called The Biochemical System of Medicine. Various reprints and variations of the book have been published. One of the most recent is The Zodiac and the Salts of Salvation Parts 1 and 2 by George W. Carey and Inez Perry, published by the Carey-Perry School of the Chemistry of Life. At the very basic level of life, without sufficient levels of the 12 essential salts being available in our foods and liquids, the human body cannot operate efficiently and various illnesses will present themselves. This may be a root cause of the failing modern approach to human medicine, since the balancing of essential salts may remove many of the symptoms of human DISEs.
At Ruth Rainis 3068 wrote,
I've literally been telling my doctors and nurses that I've seen in the last few months that my large provider of medical care in our city has turned into bureaucratic incompetence. None of it makes any sense anymore.
Terrymore 861 wrote,
Then there are seasonal diseases. It is no coincidence that various illnesses escalate at the onset of colder weather. Each human loses and replaces at least 5 billion cells every day. The immune system identifies old, poisoned and failing cells and replaces them with new cells. The cell debris is expelled through urine, feces, sweat, saliva, and breath. It is possible that examination of cell debris may be misinterpreted as being virus material. The process of cell replacement requires oxygen. Those who live in smaller homes tend to close windows in the winter to save heating costs. In offices, schools, and hospitals, to save heating costs, windows are kept closed. Some modern buildings do not have opening windows and rely on air conditioning systems, which just recycle the same air and fail to introduce fresh air and oxygen from outside. Breathing out CO2 in such environments and using up oxygen is a major cause of the breakdown of the cell replacement process. Some destroyed and some new cells turn toxic without enough oxygen for this process, and cause the illness we call flu or annual colds. Those living in tropical areas rarely contract annual winter illnesses. Strange how very few died from flu between 2020 and 2023. If the medical authorities cured flu, how come they did not cure COVID? I wonder why the government issued CO2 meters to schools and recommended that there was sufficient ventilation providing fresh air.
Terrymore 861 wrote,
Illness is the result of an imbalance in the workings of our very complex human health survival systems. The causes become more complex as life on our planet also becomes more complex. Exposure to man-made chemicals is a much more prevalent cause. The ingestion of polluted water and other liquids is another increasing cause. The use of poor quality food is another. In some countries, natural causes like snake, mosquitoes, and other insect bites, as well as attacks from various parasites, are another cause. exposure to certain household products as well as chemicals used in the production of pharmaceutical drugs, clothing, and household items are additional causes. Nobody is safe from chemical exposure. Even babies contract cancer and other illnesses. Just remember, some mothers smoke, drink, take drugs, take pharmaceutical drugs, drink poor quality chemically treated tap water, eat chemically polluted food with agrochemicals and man-made chemical food additives, as well as being exposed to chemicals in the home, as well as exposure to chemicals at work and in their environment. Chemicals are transferred via the placenta and milk. Animals exposed to chemicals in the environment do not escape modern man-made illness, and such animals pass on these chemicals when eaten. Humans living in areas where tropical and other diseases are prevalent may not be dangerous to those living in such areas, as constant exposure may have created resistance through evolution. However, visiting such areas where no natural immunity has evolved can expose a traveler to diseases for which they have no natural immunity. Poor diets, lack of enough potable water, the trials of life leading to stress are also causes of disease.
Gilles Pontier, 1814, wrote,
American healthcare is not really a system at all. It's a market. In a market, people with money can buy what they want and many people are left out. This is a quote taken from the book, The Healing of America, by T.R. Reid. So there you have it. I don't care what your political affiliation is. This isn't a left or right issue. This is a life or death issue for those who can't play in the market of the big pharma, AMA, and insurance companies. Wake up, America.
Asinsum wrote,
I'm just beginning to go on Medicare. I know that there is an annual wellness exam at zero cost. I actually wasn't planning on getting any exams. Does this interfere with Medicare? Is this exam mandatory for coverage?
Terry Moore, 861, wrote,
Few branches of medicine tackle and take diet seriously. Modern life is dangerous for human health since there are so many man-made chemicals we are exposed to in our daily lives. Our immune system is incredible. However, it cannot keep pace with and evolve quickly enough to the exposure to so many new life-threatening man-made chemical compounds and becomes confused. As a result, so many new illness symptoms are presenting themselves, which in turn are called new diseases. Then the industrial pharmaceutical industry is quick to invent new chemically based medicines. It is no coincidence that many of the pharmaceutical companies are also involved with the industrial chemical industry and are aware of the effects and causes of exposure to so many of their new man-made chemicals.
Atleric, 9140, wrote,
I am so thankful for you guys. I'm 78 and have witnessed the degradation of the system. I found a new age doctor that is a DO and is mid-30s, and he is terrific. He referred me to a cardiologist that he grew up with, and both work with me in getting off of RX scripts when the treatment can be handled with natural foods and lifestyle changes to eliminate more of the scripts. Your Ben's comments about some DRs being pharmaceutical salesmen is spot on. It's taken me over 15 years to find my current doctors.
Terry Moore, 861, wrote,
The main problem with medicine today is the overspecialization of each branch of medicine. This has caused each branch to believe that only one allopathic, Chinese, Ayurvedic, acupuncture, herbal, homeopathic, German new medicine, biomedical, energy healing, hematology, naturopathic, psychotherapy, physiotherapy, chiropractic, dentistry, massage, anesthesiology, photobiomodulation, cardiology, critical care medicine, parasitology, pathology, neuroscientific, angiology, cardiology, intensive care medicine, endocrinology, gastroenterology, geriatrics, grounding, hepatology, infectious medicine, nephrology, nutrition, neurology, neuropathy, oncology, pediatrics, pulmonology, rheumatology, vibration therapy, the 12 plus essential salts, tropical disease medicine, and sports medicine has the answer, but all have a part to play. And yet, in only a few cases, one, two, or a few branch /e's is / are the only suitable courses of action for a particular illness. The best surgeries, and there are only a few, encompass many of all branches of medicine, where doctors work together to solve and cure each illness. The best veterinary surgeries are those that also include a variety of branches of veterinary medicine. Even better than cures, prevention against illness by avoiding dangerous environments, chemicals, foods and liquids, as well as sufficient exercise and intake of a variety of foods containing all the nutrients, vitamins, minerals, and other trace elements needed for healthy lifestyles.
Terry Moore 861 wrote,
Why do we get colds in the winter? We all replace 5 billion cells in our bodies every day. The process needs oxygen to break up old and poison cells from the man-made chemicals in our foods, drinks, and environment. In the winter, we keep windows closed at home and in our bedrooms. School, hospitals, offices pack more people into smaller spaces. CO2 builds up, and there is not enough oxygen to break up old and make new cells. As a result, some cells do not break up or get replaced correctly, and these turn toxic. Winter colds are the result whilst the immune system tries to deal with the situation. This is why colds happen in the winter and not in tropical countries, unless you are in a modern house with air conditioning, which is not introducing fresh air. This is why the government did one thing right. They issued CO2 meters to schools and recommended that schools were ventilated properly. Search and watch A Farewell to Virology PT2. Dr. Mark Bailey / Steve Falconer. There is no such entity as a virus.
At Jules 7723 wrote,
Payer systems are for profit, so there is an incentive to deny services. On the flip side, healthcare providers attempt to build the ICD-10 codes that will generate the most profit. This is one reason why they use third-party billers who advertise themselves as maximizing revenue for healthcare providers. Free healthcare systems leads to those like NHS, which are just as ineffective. Too bad no governing bodies are really trying to improve and solve the healthcare boondoggle. But maybe the answer is building our own systems outside of this one.
At Mr. Milo 8607 wrote,
I'm 76 years old and retired, and have a Medicare Advantage plan for 15 years. I have never had a problem being seen by my DR or getting great care. Kaiser Permanent in CA. I may be an exception, and I am very healthy. Hope I can continue with being healthy and my DR doesn't retire.
At Lena Cummings 1313 wrote,
I refuse telehealth. Insurance is a for-profit business. The people doing the healthcare must pay the middleman INS co, and the patient must pay both the INS and the DR and the hosp. I liked it better before INS. I had no INS. I paid for each instance of care. My DRS spent time with me. They were trusted friends. They stayed as long as it took. We had long wait times, but we understood it was because he treated each patient like a human being in need. I brought snacks and toys for my children so the wait didn't bother them so much either. How I long for those days.
At Mike Wood YC1 wrote,
I avoid docks and hospitals. I let the immigrants fill their boots. Would rather die at home in my own bed than on a gurney in the hospital hallway. Since COVID craziness, hospitals are dead to me.
At Terry Moore 861 wrote,
Inflammations caused by terrain problems, air, water, insect and animal bites, infections, exposure to man-made chemicals. The immune system destroys and replaces 5 billion cells a day. This process needs oxygen, which is why it is a winter problem. Some people shut their windows at night to keep warm. Some work in offices, schools, hospitals with no opening windows, and thousands of chickens in sheds with no ventilation. All have insufficient oxygen for cell destruction and replacement. Half destroyed and regenerated cells turn toxic and give you a fever to help expel these imperfect cells. I wonder why the government gave out CO2 meters to schools to check CO2 buildup. No virus has ever been isolated.
At Naturescape Studio wrote,
I've been off the medical radar for a while by NOT going through all the programs they prescribe. Until now, when I can't walk a lot without pain due to spinal stenosis. I'm being plunged into the middle of a collapsing system I don't want but don't know of any way to avoid it. I've gotten healthier in the last couple years with exercise, weight and diet, yet where do you turn when you can't avoid the bone surgeon? How long can one hold off the decline of the operating system? Tried a concierge place. Horrible DR, but he gets paid well just the same.
At XXVW9EP wrote,
At 12:43, this is why I'm now taking my own notes and even actually making videos to show to my doctors with references to links of the research I've done on the internet and using AI, which BTW is right on everyone's phone, after I found out that my GP had written into my medical records that I had no family history of cancer, which is not true.
At Vicky West 1199 wrote,
My husband and I have refused to use my chart. It just blows everyone's mind in our DRS office. They don't know what to do when we tell them we don't have it and aren't going to.
At Terry Moore 861 wrote,
It is no coincidence that various illnesses escalate at the onset of colder weather. Each human loses and replaces at least 5 billion cells every day. The immune system identifies old, poisoned and failing cells and replaces them with new cells. The cell debris is expelled through urine, feces, sweat, saliva, and breath. It is possible that examination of cell debris may be misinterpreted as being virus material. The process of cell replacement requires oxygen. Those who live in smaller homes tend to close windows in the winter to save heating costs. In offices, schools, and hospitals, to save heating costs, windows are kept closed. Some modern buildings do not have opening windows and rely on air conditioning systems, which just recycle the same air and fail to introduce fresh air and oxygen from outside. Breathing out CO2 in such environments and using up oxygen is a major cause of the breakdown of the cell replacement process. You inhale 400 to 420 ppm and exhale 1700 to 2000 ppm. Some destroyed and some new cells turn toxic without enough oxygen for this process and cause the illness we call flu or annual colds. Those living in tropical areas rarely contract annual winter illnesses. Strange how very few died from flu between 2020 and 2023. If the medical authorities cured flu, how come they did not cure COVID? I wonder why the government issued CO2 meters to schools and recommended that there was sufficient ventilation providing fresh air.
At Becalavrian 6996 wrote,
I won't cooperate with Medicare wellness exams, especially the demeaning cognitive. The idea that Medicare can plan ahead your life ahead for 5 to 15 years is ludicrous.
At Terry Moore 861 wrote,
Advice from the NHS on how to avoid annual flu and sleep apnea, and how to avoid man-made chemicals and poisonous medication with side effects that require additional medication to cure a previous side effect of a previous medication, together with the NHS service that is not paying 23% of its budget on wasteful procedures and incorrect treatment resulting in compensation payments running into billions, would save as much as a third of the NHS budget. The $1 PO and T4 trillion the pharmaceutical sales in 2022 should be confiscated.
As Cheryl Johnson 206 wrote,
I was a medical transcriptionist years ago, then a medical coder, then got out of the very corrupt, pathetic system. Amazing how the medical records deteriorated with voice recognition and the EMR. Exactly as you say. So much of it is automated prescripted junk. All the same crap on everyone's record.
Pamela Lacey 9612 wrote,
You never call and talk to your doctor. The medical establishment has tied their hands and made them produce 15 appointments. They have no time to think or talk. I know I have worked for doctors in offices. They are scheduled so tight there is no time for personal care. When you see a doc, you are scheduled for one complaint for visit. They are not interested in anything else. A lot of it is not their fault, it is the establishment.
Jessica Malley 6201 wrote,
Our primary care physician internal medicine doc is pretty grounded. My specialists, cardiologists, are part-timers who travel between 2 to 3 states, semi-retired. My long-time cardiologists moved to be closer to family. Luckily, they don't argue too much about what pharmaceutical statins and some vaccines we won't take. The doc I know best and I had a conversation about doctors being captive in the hospital/clinic system. He cited malpractice insurance as a major factor, but did not like his compensation tied to offering vaccines, etc. I worked for family practice and internal medicine specialist 40 years ago. Much better system in my opinion when they were not tied to business production/clearance.
Catherine Hazer 7336 wrote,
Irony of ironies. Electronic medical records was supposed to streamline each patient's treatment care information via informatics across medical specialties, etc. Healthcare has been hijacked via the corporatocracy system through and through. Enough PIEIN teach, you sky fed up on it already. Enough fixes.
James Suman wrote,
There is a cardiologist, Drt. Levy, who got so fed up that he went back to college and earned a law degree to deal with the system.
Air Raider 2004 wrote,
My issue was never getting an appointment. My issue was, I tracked what was going on in my own body for months. Went in with data. Then they dismissed me and didn't even look at what data I had. Didn't order the one lab test I wanted. And prescribed me a drug that I didn't need. I immediately went to a different doctor and kept tracking what was going on. At this point, ChatGPT and Google are my absolute friends because at least I am researching and trying to find out what is going on.
Ramblin' Roses 07 wrote,
From the people's point of view, it's because we've come to realize that we are not patients in a healthcare system, we are customers in a wealth system. It's the love of dollar.
Antisocial Redneck Nerd wrote,
We have multiple issues with our healthcare system. I am not in favor of more government involvement because regulations can cause far more problems than they resolve. But I have seen multiple cases of billing where the hospital charge was 5 times or more than the amount paid by insurance. I wonder if this is real. Is this just the hospitals and insurance making it seem like they are saving massive money? If it is real, I have to conclude that we have a real problem. If it were a %10 reduction in cost, that would seem real. An uninsured person who has to pay 5 times what an insured person pays is just wrong. Also, as someone who will be moving to Medicare soon, I see that it may cost me far more than the current payments I make for insurance from my employer. All because I make good money and am converting stock options to more stable accounts. And Medicare considers the last 2 years of net pay when setting rates. I feel like I am getting penalized for doing things right. It also seems like your medication cost for countries like Canada is lower than what insurance companies pay for medications. It is almost like people in the US are expected to pay the development cost. It seems like other countries should share the cost. We have lots of emergency care, or doc-in-a-box providers and fewer primary care providers. That goes back to things being incorporated, which goes back to insurance being difficult to deal with and kind of a bully. But how do we fix this issue?
Gail Nichols 842 wrote,
Please consider. There is a superbug in California that killed my neighbor in July 2024 after back surgery and is now killing my brother-in-law after urinary tract surgery. The antibiotics are not curing the infections. What happened to me may help solve this issue with the overprescription of antibiotics. In April 2025, I had lab work done that showed I had bacteria in my urine. My doctor immediately prescribed an antibiotic. I told her I had no symptoms. She said then don't take it. I had more lab work done in July that I paid for. Again, a different lab reported I had either a kidney or bladder infection. Convinced I needed a prescription, I asked my pharmacist if the prescription I had picked up in April was good for a kidney infection. She said, no, I needed something stronger. I emailed my doctor and left a lengthy message with the office making my request known and the second lab report. 3 weeks later, I still had no response, so I went to urgent care with the 2 lab reports. They gave me a third urine test, different this time because I was told HOW to get a urine sample. The previous labs had only automated systems in the front room. In their effort to save money, no people are in the front office. This third test came out no infection. Could the overprescription of antibiotics for UTI be causing our superbugs?
Rhoda W1E wrote,
Some of the best hospitals were owned by physicians. In Houston decades ago, there were at least 2 I know of. Great patient care, and the physicians worked happily there.
XXVW9EP wrote,
Australia's healthcare system is facing a severe and worsening crisis, characterized by soaring hospital waiting lists, significant delays in emergency and elective care, and a strain on healthcare workers. A government report from February 2023 revealed that 3.5% of Australians delayed or skipped visits to their general practitioner in 2021 to 22 due to cost, up from 2.4% the previous year, and nearly a quarter delayed seeing a mental health professional because of affordability. The crisis extends to emergency departments, where the national average of patients being seen on time across all triage categories reached its lowest level in a decade, with just 56% of patients treated and discharged within 4 hours. The situation is particularly dire for planned surgeries, with the national median waiting time for such procedures reaching 49 days in the 2022-23 financial year, an increase of 9 days from the previous year and 13 days longer than a decade prior. This backlog is described as unacceptable by the Australian Medical Association AMA, which warns that Australians are waiting almost twice as long for planned surgery as they were 20 years ago. The proportion of patients receiving urgent Category 2 surgeries, such as heart valve replacements and fracture repairs, within the recommended 90-day timeframe has fallen to a record low. In some states, the situation is worse. New South Wales has the longest wait times at 69 days, while Western Australia's median wait time is 51 days. The Northern Territory is a relative outlier, with a national leading median wait time of 29 days. The crisis is not limited to wait times. Healthcare professionals report dire conditions, including resuscitating patients in waiting rooms and corridors, administering 4 antibiotics in chairs, and patients suffering severe pain due to the inability to receive care in appropriate, safe environments. Sarah Whitelaw, an emergency medicine representative for the AMA, stated that the system is failing patients and staff, with doctors and nurses leaving the field due to burnout and the inability to provide adequate care. The AMA attributes the crisis to chronic underfunding, outdated funding models, and a lack of investment in workforce capacity. A new National Health Reform Agreement (NHRA) set to take effect in mid-2025, is expected to bring increased federal funding, which the AMA welcomes but emphasizes is not enough to address the immediate backlog. The association is calling for a $4 PO in T12 billion national plan to tackle the surgery backlog during the NHRA negotiations. The crisis is also impacting regional Australians who face significant barriers to accessing timely healthcare, a situation described as a crisis by political figures. The AMA president, Professor Steve Robson, stresses that the current state of the system, marked by overworked and burned-out staff and unsafe working hours, is unsustainable and requires urgent federal action. AI-generated answer. Please verify critical facts.
David Bland 6495 wrote,
What I don't like is when a doctor wants you to get test and insurance rejected it because of the insurance company third party that's work for the insurance company. They decide necessary test or not cause they looked over all medical records and make the decision to let you get the test or not. In the meantime, it in paid or suffering insurance company is a big RIP of, especially for us senior. It like if over 65, they do everything they can to make sure you don't make it to 70.
At Mitchell Lebelnosen 3972 wrote,
I'm sorry, but what I see as a nurse is a ton of people constantly in the hospital because they won't / refuse to help themselves. I know a lot of people need help, but I work in dialysis, and I see a lot of people who flat out refuse to help themselves. Then they get admitted over and over. Really, a few people abuse the system, use all the resources.
Joyce Clark 8163 wrote,
Here in the US, our healthcare in our city / town / counties started on a downhill slope when the hospital took over the many doctors' offices. All but one ABD he has since retired. The doctors' offices allowed their office people / nurses to vote if they wanted the hospital to manage their offices. And the employees of the offices voted yes because they were given healthcare by the hospital. A hospital has a monopoly on everything the doctors' offices do. Another big decrease in healthcare was our own doctors used to manage a care while in the hospital, but is managed by hospitalists. And you never are seen by the same one. It's way more costly with poor management of your care. This isn't new to our area. It happened about 35 years ago. Also, the hospital claims to be a non-profit hospital, but are constantly buying up other hospitals. Even in our neighboring state. They now own 4 hospitals and have built a new one about 12 miles away from the main hospital where it all started. So how they claim to be non-profit is beyond me. Plus diagnostic offices and probably at least 40 new doctors' offices that they have built. If not more. Then add in the care you receive now after the pandemic, whether at the doctor's offices or the hospital or at a rehab facility, is almost deplorable. Never mind the cost, which is outrageous. From lab work to diagnostic testing. My doctor's office now has 2 separate charges. One for seeing the provider. And one for the 1 THST takes your vital signs. Height and weight. And same for the lab that does blood work. One charge for running the test and another charge for inserting the needle.
At XXVW9EP wrote,
Cities are better off than rural regional areas where there mightn't even be any doctors, and they rely on telehealth and having to transport patients for long distances for emergency care.
At JLJ 547 wrote,
Insurance companies on a whole, no matter what industry, has become a parasite. Lawmakers should rein them in, but at this point that is more of a pipe dream.
At Stop the World and Let Me wrote,
If I need to reach out to my family physician, they only communicate by text. How can you communicate health issues over a text? They refuse to pick up the phone and talk to you. I have to make an appointment to discuss any lab results or if I have any questions.
At Matt Gardner 5980 wrote,
Notes are either subjective or objective. then outside a doctor's eyes or relation to the patient, there is then a world of outside information being required by government or influenced by other external controls.
At Jerry4281 wrote,
I love your content. Living in Canada, I'm dreading the same thing happening here. I have great doctors and I try to stay healthy at 73. Have hemochromatosis, which is well managed. Otherwise healthy. I like John Campbell and all the specialists he interviews from all over the world. Thank you.
At MattGardner5980 wrote,
Doctors prefer not to document anything if that were possible. EMR made more required in specificity because the government is paying for everything it has to be accounted for the value and price.
At Tabak5416 wrote,
The last few times I went to the doctor a decade or so ago, they used to ask me, does your home have smoke detectors? Do you ever feel sad or hopeless? Do you have a gun in the home? Do you drink alcohol? The last time I went, I told them my pit bull accidentally discharged his assault weapon using the family trampoline. They were not amused.
At Mimi Collier wrote,
I pay high premiums and out of pocket is unreal. I've started seeing an integrative medicine doctor and pay out of pocket. I'm getting better care and they spend quality time with me. As a patient in traditional medicine, they always make you fill out all kinds of paperwork and ask if you have thought about harming yourself. No, I don't. But after doing all of this paperwork, I might want to.
At MattGardner5980 wrote,
The protocols and acuity are probably the greater issues. People in us are sicker. Protocols are often risk-based without evidence, but require much time, so hospitals spend much time protecting themselves.
At Fox0071WR wrote,
When I stop getting asked a bunch of irrelevant questions, especially by the gov, I lie. Some things are none of their business. Do I trust the medical establishment? No. 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 Do I trust my government? Helen no.
Kinkle_Z wrote,
I found that a huge red flag is a doctor who won't take a cash payment because they're being paid by insurance companies to give minimal care. The insurance companies are the new patient.
At MattGardner5980 wrote,
Okay, that is false about Epic. They virtually have a monopoly. Interoperability is a core goal of EMR legislated in US. Since controls most they are interoperating.
At Janice Vineyard, KF6WM wrote,
Many years ago, I told a nurse coworker hospitals are going to be places you can't pay people to go to and somewhere to pass away in. Can't make people care.
At Anonymous Cat 4868 wrote,
324 I have had nothing but problems with my healthcare. I live in Central Oregon. One medical group is buying up all the other care providers. Our hospital is owned and run by the same group. The quality of care is a joke. I can't even believe some of these doctors I've seen are truly accredited. When I try to reach my pain management provider, I can be on hold for over an hour. Then, the call goes to someone in an out-of-state call center. The MyChart system is horrible. If you're not careful, they will use it exclusively to communicate with a patient, even for appointments and billing. So, I may have a test result or a prescription request that I can only find out about by going online to their closed system and look through their information to look for messages to me, no phone calls, and certainly no follow-up. The worst part is that they do this with the billing. Unbelievable. They automatically put you on paperless billing. I had to chase down a bill that was sent by a collection agency for a copay. It was only $30, but I always pay my copay. I just paid it so I could get off the phone with the idiots. I would rather be in physical pain than the stress of dealing with these horrible people.
At KitPie 80 wrote,
Collapse? Didn't notice. Haven't been for 10 years. Is already dead and useless to me. If I need help, I'll get a coach, shaman, massage therapist. Don't even need dentist.
At Gene Kipper 6954 wrote,
A friend in Wisconsin was diagnosed with cancer and was given a protocol prescribed by a doctor in a town 150 miles away, administered by a nurse practitioner nearby. She never saw the doctor. After surviving treatment, she was asked to participate in a drug development experiment with no clear benefit to her and potentially fatal side effects. Our system is obscene. I'm utilizing traditional Chinese medicine as much as possible. It's centuries old, used by over 1 billion people, and is not for profit. They don't have to make a killing on caring for people, and I mean that literally.
At 3 Taps New 0 UT 87 wrote,
I know personally how irresponsible the public healthcare system is, for the reasons you state, but to be honest, I think the health industry leads the way.
At Jules 4028 wrote,
It is scattered and emo-DR apps. Slash technology doesn't seem to be helping matters. Although it has provided some detailed databases, along with several breaches of info. Reportedly cyber hacking,